My name is Katie. I live in Wilmington, North Carolina. It's a really nice, small community, a great place to raise children. I've been a registered nurse for 36 years, and I'm also a caregiver for my adult son living with schizophrenia. Nursing, it was a love. It's something that was perfect for me to do. However, caring for a loved one with a mental illness is nothing I had ever imagined in my nursing career. There's no logic to really talking or trying to caregive to a loved one who is experiencing schizophrenia. You have to have patience. He needed some sort of medication. Of course, what did they offer him? Pills. My son did not feel well on the oral medication that they had prescribed him. So he was not taking the pills, which really created a tremendous amount of tension. It wasn't just him that had to experience the things, it was me having to experience them with him. And once I started doing that and learning about the disease and what it felt like in their mind, it really helped me put together what my son was experiencing. I learned about INVEGA SUSTENNA long-acting injections at a support group.
What is the most important information I should know about INVEGA SUSTENNA, paliperidone palmitate? INVEGA SUSTENNA is a prescription medicine given by injection every month by a healthcare professional and used to treat schizophrenia in adults. INVEGA SUSTENNA can cause serious side effects, including an increased risk of death in elderly people who are confused, have memory loss, and have lost touch with reality, dementia-related psychosis. INVEGA SUSTENNA is not for treating dementia-related psychosis.
At group one night, I listened to how well somebody else's son was doing on the INVEGA SUSTENNA. And there's an injectable? Oh. I knew that if he had the injectable, that would relieve my anxiety because I knew he took the medication. With the INVEGA SUSTENNA LAI, he could feel his symptoms quieting in his head. He was able to focus. He could organize himself. I didn't feel like I had to organize him. He was able to mature and make responsible decisions. He made the decision to buy a dog and Elvis and apply to school. I always knew he was more than capable. He just graduated law school and getting ready to sit for the bar. Here is his gown and his hood. Love the colors, of course. It was an absolute celebration day for me and for a lot of his family members. Long-acting injections completely changed our dynamic emotionally. He could hug me, which was huge. People, think that law school is all this wonderful thing, this academic thing, but to not be able to hug your child? Or because in their head that they're thinking you're this awful thing. He was able to emotionally connect with me again. Tell me he loved me. He was so apologetic. And to the point where I was like, you don't need to apologize at all. I'm so happy that you're back. If you are early in your journey with your loved one who is experiencing schizophrenia, you are in a marathon. But I'm here to tell you there is hope. I'm here to tell you that there are other options besides pills. You do not have to fight that daily battle with long-acting injections. Perseverance, I guess that's the biggest thing for both of us. As a caregiver, it is very important to take time for yourself. You need to be a person again to never give up, believe in hope. Hope and help are out there for you.
Please see the important safety information at the end of this video and speak with your healthcare professional for more information.
Indications: INVEGA SUSTENNA, paliperidone palmitate, extended-release injectable suspension, is a prescription medicine given by injection by a healthcare professional. INVEGA SUSTENNA is used to treat schizophrenia in adults. Important safety information. What is the most important information I should know about INVEGA SUSTENNA? INVEGA SUSTENNA can cause serious side effects, including an increased risk of death in elderly people who are confused, have memory loss, and have lost touch with reality, dementia-related psychosis. INVEGA SUSTENNA is not for treating dementia-related psychosis. Do not receive INVEGA SUSTENNA if you are allergic to paliperidone, paliperidone palmitate, risperidone, or any of the ingredients in INVEGA SUSTENNA. See the end of the patient information leaflet in the full prescribing information for a complete list of INVEGA SUSTENNA ingredients. Before you receive INVEGA SUSTENNA, tell your healthcare provider about all your medical conditions, including if you have had neuroleptic malignant syndrome, NMS, have or have had heart problems, including a heart attack, heart failure, abnormal heart rhythm, or long QT syndrome, have or have had low levels of potassium or magnesium in your blood, have or have had uncontrolled movements of your tongue, face, mouth, or jaw, tardive dyskinesia, have or have had kidney or liver problems, have diabetes or have a family history of diabetes, have had a low white blood cell count, have had problems with dizziness or fainting, or are being treated for high blood pressure, have or have had seizures or epilepsy, have any other medical conditions, are pregnant or plan to become pregnant. It is not known if INVEGA SUSTENNA will harm your unborn baby. If you become pregnant while taking INVEGA SUSTENNA, talk to your healthcare professional about registering with the National Pregnancy Registry for atypical antipsychotics. You can register by calling 1-866-961-2388 or visit http://womensmentalhealth.org/clinical-and-research-programs/pregnancy-registry/. Infants born to women who are treated with INVEGA SUSTENNA may experience symptoms such as tremors, irritability, excessive sleepiness, eye twitching, muscle spasms, decreased appetite, difficulty breathing, or abnormal movement of arms and legs. Let your healthcare professional know if these symptoms occur. Are breastfeeding or plan to breastfeed? INVEGA SUSTENNA can pass into your breast milk. Talk to your healthcare professional about the best way to feed your baby if you receive INVEGA SUSTENNA. Tell your healthcare providers about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Know the medicines you take. Keep a list of them to show to your healthcare provider or pharmacist when you get a new medicine. Patients, particularly the elderly taking antipsychotics with certain health conditions, or those on long-term therapy, should be evaluated by their healthcare professional for the potential risk of falls. What should I avoid while receiving INVEGA SUSTENNA? INVEGA SUSTENNA may affect your ability to make decisions, think clearly, or react quickly. Do not drive, operate heavy machinery, or do other dangerous activities until you know how INVEGA SUSTENNA affects you. Avoid getting overheated or dehydrated. INVEGA SUSTENNA may cause serious side effects, including: C. What is the most important information I should know about INVEGA SUSTENNA? Stroke in elderly people, cerebrovascular problems that can lead to death, neuroleptic malignant syndrome, NMS. NMS is a rare but very serious problem that can happen in people who receive INVEGA SUSTENNA. NMS can cause death and must be treated in a hospital. Call your healthcare providers right away if you become severely ill and have any of these symptoms: high fever, severe muscle stiffness, confusion, loss of consciousness, changes in your breathing, heartbeat, and blood pressure. Problems with your heartbeat. These heart problems can cause death. Call your healthcare providers right away if you have any of these symptoms: passing out or feeling like you will pass out, dizziness, or feeling as if your heart is pounding or missing beats. uncontrolled movements of your tongue, face, mouth, or jaw, tardive dyskinesia. Metabolic changes. Metabolic changes may include high blood sugar, hyperglycemia, diabetes mellitus, and changes in the fat levels in your blood, dyslipidemia, and weight gain. Low blood pressure and fainting. Changes in your blood cell counts. High level of prolactin in your blood, hyperprolactinemia. INVEGA SUSTENNA may cause a rise in the blood levels of a hormone called prolactin, hyperprolactinemia, that may cause side effects, including missed menstrual periods, leakage of milk from the breasts, development of breasts in men, or problems with erection. Problems thinking clearly and moving your body. Seizures. Difficulty swallowing that can cause food or liquid to get into your lungs. Prolonged or painful erection lasting more than 4 hours. Call your healthcare provider or go to your nearest emergency room right away if you have an erection that lasts more than 4 hours. Problems with control of your body temperature, especially when you exercise a lot or spend time doing things that make you warm. It is important for you to drink water to avoid dehydration. The most common side effects of INVEGA SUSTENNA include injection site reactions, sleepiness or drowsiness, dizziness, feeling restlessness or needing to be constantly moving, abnormal muscle movements including tremor, shaking, shuffling, uncontrolled involuntary movements, and abnormal movements of your eyes. Tell your healthcare providers if you have any side effect that bothers you or does not go away. These are not all the possible side effects of INVEGA SUSTENNA. For more information, ask your healthcare provider or pharmacist. Call your doctor for medical advice about side effects. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. General information about the safe and effective use of INVEGA SUSTENNA. Medicines are sometimes prescribed for purposes other than those listed in a patient information leaflet. Do not use INVEGA SUSTENNA for a condition for which it was not prescribed. Do not give INVEGA SUSTENNA to other people, even if they have the same symptoms that you have. It may harm them. You can ask your pharmacist or healthcare provider for information about INVEGA SUSTENNA that is written for healthcare professionals. This patient information leaflet summarizes the most important information about INVEGA SUSTENNA. If you would like more information, talk with your healthcare provider. You can ask your healthcare provider or pharmacist for more information that is written for healthcare professionals. For more information, go to www.invegasustenna.com or call 1-800-526-7736. Please read the full prescribing information, including boxed warning for INVEGA SUSTENNA, and discuss any questions you have with your healthcare professional.